Welcome and greetings from beautiful Sioux Falls, South Dakota. I'm Marilyn Serafini, and I'm Executive Director of the Health Program at the Bipartisan Policy Center. We're normally coming to you from Washington, D.C. Today we are in Sioux Falls because we are hitting the road with a significant problem. And we felt like we needed to get out into rural America to really help to understand the great innovation and the programs and also the challenges that are around youth behavioral health. Today's program, Resilience in Remote Places, Crisis Responses for Rural Youth. In January, the Bipartisan Policy Center launched a youth mental health and substance use task force with the generous support of the Helmsley Charitable Trust. And this is a pivotal moment for us to be able to put forward a set of actionable federal policy solutions to the crisis that we see continuing across the country. The youth mental health and substance use rates have been soaring. This didn't start with the pandemic, but the pandemic sure did make it worse. We have a significant amount of growing depression and anxiety reported from our youth. And we know that this is especially true in rural areas where everything is harder. We as an organization are working with our task force to develop bipartisan, actionable policy solutions to deal with the growing gap between the services that are needed and the services that we can supply at the moment. We have with us today a really great group of experts and stakeholders to help us explore some of what we are seeing on the ground. And we also are delighted to have with us one of our task force co-chair people, former Congresswoman Val Demings. And the Congresswoman is from Florida. She represented Florida, and she also is a former police chief, so she really knows a lot about this on the ground. Before we get started with our panels, we'd like to introduce former Senator Tom Daschle, who we're here in South Dakota, so he's certainly no stranger. He is a co-founder of the Bipartisan Policy Center, and he wanted to welcome you all to this event. He's sorry he could not be with you personally here today, but let's hear now from Senator Daschle.
Hello, and welcome to the Bipartisan Policy Center and Helmsley Charitable Trust event, very aptly titled Resilience in Remote Places, Crisis Response for Rural Youth. I'm sorry that I'm not able to be with you today for this important event. It's truly an honor to help bring together two things I care so much about: bipartisanship and the good people of our state of South Dakota. Throughout my career in public service, I've seen how bipartisanship can lead to lasting, meaningful change. As a co-founder of the Bipartisan Policy Center, I'm pleased to see BPC's work and policy impact continue to grow over the last 17 years. As we gather today, it's crucial to acknowledge that mental health issues transcend boundaries, impacting individuals and families from all walks of life across our nation. The mental health crisis affecting our children and young adults is particularly concerning. For far too long, rural America, including my beloved home state, has grappled with the unique barriers hindering access to essential care and support. It's estimated, as some of you probably know, that at least 30,000 adults in South Dakota suffer from a serious mental illness. And during COVID, it's been well reported that almost 30% of adults in the state reported symptoms of anxiety or depression. Tragically, the age-adjusted suicide rate in South Dakota is nearly twice the national level. Throughout my tenure in the Senate, I worked with members on both sides of the aisle on initiatives aimed at expanding mental health services, including early federal laws mandating insurance coverage for mental health. And while progress has been made, there remains much unfinished business. That's why I hope in initiatives like BPC's Youth Mental Health and Substance Use Task Force, spearheaded by leaders across party lines, can make a big difference. This group is dedicated to crafting practical, evidence-based policy solutions to address the crisis facing our youth, with recommendations forthcoming to Congress and to the administration. So today, we'll hear from individuals working tirelessly at the grassroots and state level to improve access to mental health services, particularly for youth in rural areas experiencing crisis. And I want to extend my profound gratitude to the Helmsley Charitable Trust for their pivotal role in bringing this event together. Their unwavering commitment to both rural and behavioral health initiatives is absolutely invaluable. And we're immensely fortunate to count them as partners in both our rural and behavioral health work. So without further ado, I'll now turn it over to our esteemed panelists to continue this vital conversation.
Thank you, Senator Daschle. I am absolutely delighted to have with us today Sarah Jane Tribble. She's Chief Rural Health Correspondent for KFF Health News. I have to say that it's formerly KHN, Kaiser Health News, because I think some people will recognize that name. So Sarah has been covering rural health care for a long time in a really thoughtful way. She covers the state of healthcare in rural America. Previously, she produced award-winning coverage on prescription drug prices and the rare disease drug industry. Her work appears in the Washington Post and USA Today. She's a regular contributor to NPR's Morning Edition and All Things Considered. So let's welcome Sarah, and Sarah will introduce the panel.
Thanks for being here today, everyone. I really appreciate it. I think this is going to be a great event. We've got some really great, very engaging speakers. As you heard, I'm Sarah Jane Tribble with KFF Health News. We started a rural health team a couple of years ago. We have reporters here in South Dakota, in Nevada, Michigan, Iowa, and I am based in Washington, D.C. To kind of launch this off, I'd like to echo what Senator Daschle said and read a few headlines from the last year that have gone across the country. The datelines include North Carolina, Kansas, and Nevada. New youth suicide bill to help address rural mental health concerns, February 2024. Why America has a youth mental health crisis, October 2023. Rural schools take on the mental health crisis, September 2023. As Senator Daschle said, there's no geographic hotspot. There's no specific demographic makeup. There's no normal when it comes to behavioral and mental health and substance use issues. And today, we're going to have a good, lively conversation, a couple of them. And I'm so excited to start the conversation with a fireside chat, a chat with two very important people who are taking part in this. There's Mayor Paul Tenhaken. He's been the mayor of Sioux Falls since 2018. Before that, he was the founder of an early social media company, ClickRain. And since taking office, he recognized the mental health and substance abuse issues in the city and the state and addressed them directly. We're going to talk about that. We also have with us former Congresswoman Val Demings. She is not only a former police officer, as we heard in the intro, but she's also a former social worker. And she took her lived lessons to Washington, D.C., and addressed them directly, and addressed the national issues directly, working 6 years on Capitol Hill. We're going to talk to her a little bit about that. So, without further ado, let's get started and bring them up. All right, thank you. Oh, these microphones are amazing.
Yes.
All right, so let's start with you, Congresswoman Demings. Thank you for being up here. This week, kind of very timely, I don't know if the BPC timed it this way, but there was a national announcement, a new national strategy, a new suicide prevention plan put out by the President's administration. As co-chair of the BPC's task force, I was hoping you could connect the dots for us. You worked on Capitol Hill, now you're working with the researchers. How can these two worlds combine and actually address the situation on a national stage?
Well, Sarah, thank you so much for that question. It is good to be in Sioux Falls to participate in this very critical discussion. And Sarah, you said it correctly, very timely discussion. As a former social worker, 27-year police officer who served as the police chief, I know firsthand many of the challenges that communities, not just in Florida where I'm from, but all over the country face in dealing with this mental health crisis that we find ourselves in. In terms of the work of the task force, you know, if we're going to make significant progress in this area, then we've got to have an all hands on deck approach. That means the local, state, and federal government, along with the administration, have to participate in the process. Through the task force, which I'm really excited to be one of the co-chairs, we have brought a bipartisan group together. We have 4 co-chairs. One is former Governor Steve Beshear from Kansas. We have former Governor Steve Kasich. We have former House of Representatives member Jamie Butler and myself. We're the facilitators, but we have brought a group of experts together with one agenda, and that is to address the needs of our youth suffering from mental health issues, whether they're from urban communities or in rural communities, and we know the unique challenges of rural communities. I believe that with the President's announcement, it really helps to set the stage that this is a priority. On the day of our first task force meeting, Governor Kasich and I went to Capitol Hill to meet with a bipartisan group who are working in the mental health arena on legislation. And we went to also talk about the work of the task force to further see how we can better work together to get meaningful policy accomplished. And so I'm really excited about the work of the task force. We still have a long way to go, but I'm really excited about our start.
Yeah, what's really interesting about what you say is when I moved to DC in 2016, what I didn't know is the relationships, how important those relationships are. You have a relationship in Congress, the other co-chair, you all have relationships, and then you work with the staff members, and then you can take the findings, the research, the data, and take it to them.
It is impossible to get, as I'm sure many of you see, unfortunately, every day, anything done without relationships on both sides of the aisle. One of the things I've learned coming from an executive position as a police chief to Congress is a team sport. I needed 217 other members in order to get any legislation passed. And so the relationships matter, and as I heard during the video, it is difficult to hate up close. And what we find out, if we start in a place where we talk about our similarities, as opposed to starting with our differences, we find out that we're a lot more alike than not. And I believe that the work of the task force is one of those areas where we can get strong bipartisan support and really get some meaningful things done.
Thank you for that. So to bring it a little bit more local, Mayor, you did not run on a mental health platform. You didn't market yourself as somebody who could fix a massive substance abuse mental health problem, but then shortly after taking office, you saw the issue and you addressed it. I was hoping you can talk to us a little about what you saw, and then of course the link and how you addressed it.
Yeah, thank you for the question. So I was elected as mayor in 2018, and that was a different world then. And then 2020 happened, and so the 4 years since that have been almost like a second term within a term, because the world has changed, and the mental fragility that I've seen in our communities has just really been exacerbated by racial tensions, by obviously what the pandemic did, remote learning. And it became apparent as I would go to schools and meet with people and talk with our cops about crime. Thank you so much for your service, by the way, as an officer. That there was a mental health thread through a lot of the challenges we were facing in our community. And at the same time, our community had been talking for 7, 8 years about the need to create a triage center for people experiencing mental health and addiction issues. And so all these things kind of coalesced, and in 2021 we opened the doors for a place called The Link here in Sioux Falls. The Link, by name, is a place where we link people to services that they may need. Primarily, we're seeing people with substance abuse issues, detox and sobering, and linking people to this facility that we're in today. We have an incredible partner in Avera Health in that work. But the challenge is sometimes you feel like you're in the boat with holes in it, and you're bailing, and the water's still coming up. You're bailing, and you're making some impact, but you're not keeping up. And even in Sioux Falls last year, we had 37 completed suicides. This community is 215,000, 300,000 in the MSA, and the state's about 900,000. So about a third of the people in the state live in this MSA. 37 completed suicides. The year before we had 22. And the way it's trending, even the first quarter of this year, we're going to be very similar to that last year, which was a record year. And so, not that suicides are the metric for mental health, but it's just one of many metrics we look at, and it's a problem, and it's a challenge, and there's only so much you can do as a mayor, so we rely very heavily on what's our state doing with funding issues, what's happening on our reservations. There's a disproportionate amount of our Native American community that's affected by mental health and suicide issues. Rural suicides are a big challenge, so it's sometimes overwhelming when you look at the gravity of the issue, and I think we at the local level just have to keep reminding ourselves, hey, and I use this term a lot, we got to just keep hitting singles. There's no home runs in this topic. What are some singles we can keep hitting? The Link is a single. Some of the policies we're trying to do locally are singles. What you guys are doing are singles. And you can win a game by just hitting a lot of singles.
I heard you mention the Native American population, the rural population. One of the reasons we're here today is to talk about the youth population. Have you seen a connection with the youth through the Link? Are you impacting that population as well?
So we don't serve youth at the Link, but I will say that the facility that we're in right now, and I can't speak for Avera, and I'm sure they'll have an opportunity here today. They have been expanding their youth services needs because the need is so overwhelming, and so one thing that we're doing on the local level. There's obviously a need. There's a need to recognize and make sure that our youth have the resources they need. But one of the things that youth struggling with mental health need is a mentor. And as cliche and kind of corny and simple as that sounds, there's a lot of youth living in very dark, lonely places, single-parent homes, no good role models in their life. That forces them to a life on screens, which is a whole nother topic about what that's doing to our kids and their mental health. And so getting people to have one-on-one relationships with our youth is something I'm really bullish on. I push mentoring a lot because I think it's one of the singles we can keep hitting to make sure we're impacting our youth in a positive way.
Congresswoman, I want to kind of extend on that youth conversation and ask you a little bit to pull from your lived experience, and then also I know you've been working with younger folks more recently, that intersection of the juvenile justice system and behavioral health. I think any of us who have been out in the communities doing reporting or spending time with policymakers, we see that happening, that intersection. So can you talk just a little bit about how impactful that intersection is and what needs to be done?
In Orange County, Florida, we say that the Orange County Jail or the Youth Detention Center is the biggest mental health treatment facility and the biggest drug treatment facility in the region. And I'm sure that there are jurisdictions in America that would probably say the same thing. So regardless of where you are, which part of the country, that fact is totally unacceptable. Studies show that about 2/3 of our youth who are in juvenile detention centers, or some are in jail, have a diagnosable mental health condition. So we have left a problem that I believe, and I sit here as a former lawmaker, that America has not done enough to address. We've put that crisis, that state of emergency involving our youth, in the hand of the police. I've heard police chiefs say all over this country that we call the police for everything. Mental health crisis, drug addiction, child misbehaving in school. But we've learned through data that a large percentage of the children who even get in trouble in school are suffering from a mental health condition. And so now that we know better, we've got to do better. I'm seeing more and more jurisdictions throughout the nation, I know we're doing it here, where police officers are pairing up, partnering with mental health professionals. So the call also involves a mental health professional who is responding, so those persons can hopefully get the adequate care that they need. We're seeing that occurring more and more all over the country. That is a good thing. But you know, when we think about our budgets, in Congress we used to say our budget is a reflection of our priorities, a reflection of our values. And so when we look at the obstacles to adequate care, certainly making it solely a law enforcement response is not enough. If we're going to help America's children, and I think they are sure enough worth it, then we've got to make sure that we have the resources available throughout this nation, regardless of where you live, to adequately support our children who are in crisis. This is not just a law enforcement problem. We've made it that with our poor response, but it is an American problem, and we've got to address it.
Yeah, one of my colleagues had on KFF Health News today a story out of Utah where a jail was pairing up community health workers with everybody who was leaving the jail. And they quoted a National Sheriff's Association person. So yeah, it's very relevant right now. But the crisis we're talking about, the pandemic happened, right? So this crisis existed before the pandemic. Mayor, you had said in a conversation previously that the pandemic poured gas on this crisis. What do you think happened during the pandemic that poured gas, particularly on the youth, and caused this crisis to explode?
Well, you know, gospel according to Paul, I'm just in my opinion here, but when we put a lot of our kids in remote learning environments away from social interaction, and when you isolate people, I don't care if you're a kid, an adult, a senior in a senior living facility, isolation is not good for your mental health. We are designed to be in community with one another, okay? We are designed, and to your point, you can't hate someone when you're face to face. Those in-person interactions are so critical, and we normalized remote behavior. We still have in the workplace, and it's not. We're made to be in person, and especially at those very vulnerable, impressionable ages for kids. And so I see communities, and it wasn't that bad in South Dakota, but communities that really didn't get kids back in community and in the classrooms for extended periods of time, really struggling, not only with the education lag, but with the mental health lag as well. You know, I'm going to share a quick story. I didn't even occur to me, this story, until you were just talking, but I did a ride-along with one of our cops in 2021. And we got a call, and there was a suicidal young lady. And this cop and I went to this apartment, and we went up the stairs. It was not a nice apartment. And this young lady had locked herself in the bathroom, and she had been there for a couple hours. Dad couldn't get her out. Dad was very disengaged, sitting on the couch. I think he cared, but not really. We got the door open, had to kind of force it open. This young lady was cutting her arms, and talked her down. I saw a cop, this wasn't a social worker, this was a cop, use de-escalation training that these cops have, and the compassion that this cop shared with this young lady was something you would expect from a sweet therapist. You know, this big 250-pound dude got this girl to open the door, walked out to the car. We brought her to this place right behind us, and I saw such a broken kid, man. And I could see, just from her home life for the 10 minutes I was in there, that this kid has a very challenging life. So the challenge then is, what do I, as a mayor, do about that? I know that exists, and I know that exists in a lot of different places. What if parents disengaged? The kid obviously has went through a tough time in the past year with school and remote learning and all that stuff. What is the role we can do? What can we do? And I tell you, it is such a wicked problem. We have wicked problems in government. Homelessness is a wicked problem. This is a wicked problem. That's so hard to figure out what a solution is. But I think those kids, and making sure, and back to my point about mentoring, it was fairly apparent she had a disengaged family. And that girl needs to know she's special and she's loved and someone cares about her. And so making those connections, I think, are just really, really important. And I keep going back to that nuclear family, making sure those kids have someone who cares for them, I think is a big part of making sure their mental health is in a good place.
And if I may too, and Mayor, thank you so much for your story about the police officer using his de-escalation skills. And many police departments do receive crisis intervention training for these moments, right? But again, when we know better, we're supposed to do better. And leaving it in the hands of law enforcement is not the answer. And I'll go back to COVID-19 because, you know, COVID-19 was something we'd never seen before. And it required us to do some things that we had never done before. We took, at the local, state, and federal level, a significant amount of time just trying to figure it out. We lost 1 million people in this country. 1 million people lost their lives. And jurisdictions, and I won't criticize or even sound like I'm criticizing jurisdictions for taking steps that they felt would preserve life and keep people safe. What we did not figure out, though, is getting kids, closing the schools, the long-term effects of the isolation, separating children from the positive influences in their lives, their friends, their teammates, their teachers, their coaches, all of those things. We know the significant role that teachers play in keeping our children safe. They're doing a heck of a lot more than just teaching reading, writing, and arithmetic. Kids having a bad day, who knows that first? Probably the teachers and the persons in school. We never really factored in the long-term effects of isolating children, but now we know better. And God forbid if we face another pandemic, we certainly ought to be able to do better. But it goes back to making sure that the services that our children need to be whole are available and accessible and affordable.
Mm-hmm.
You know, when you hear these one-off examples, it seems a little overwhelming. How do we get a grasp on how big it is? One of the things in the new federal strategy is to collect data. And I wanted to ask you about this, Congresswoman, because you, in 2022, had an amendment added to sort of a big bill, and it required the collection of data by the FBI and another agency to gather data on how police officers, law enforcement officials, were doing with their own mental health and how they were getting treatment. How does data, when you collect it like this in mass, how does it help address the problems of this one young lady?
You know, with law enforcement, it's a tough job. You don't have to be in it to know that. It's a dangerous job. Police officers are at risk of physical and mental trauma every time they put on the uniform. And we expect them to do the job and do it well, but we don't do a great job of dealing with the consequences of that job. How can we expect law enforcement officers to take care of us if we don't take care of them? In order to get the support that we need, the resources that we need, the programs that we need, data is everything. Data is factual information that we don't have to justify, really. Don't have to, or should not have to spend a whole lot of time. We can have the greatest program, the greatest policy in the world, but if we do not have the research, the evidence-based research and data to support it, it may fall by the wayside. The first piece of legislation, bipartisan legislation that I worked on, involved mental health and wellness for law enforcement officers. The data is everything. That's why it was so critical to get that amendment in the bill, and it passed the amendment did 400 to 10.
Wow.
And so it was a great example of bipartisan support where everybody, the majority of the House members, certainly understand the need and the importance of collecting data.
Yeah, as you talk about that, I'm thinking about the data that's in the new federal report that came out, and one of the notes, it emphasizes equity, and it really reveals some numbers on equity. Between 2018 and 2021, suicide rates for Black and African Americans increased 36.6% among those 10 to 24 years old. That's nationwide, of course. And if we start collecting that data everywhere, then, and maybe it's being done on different planes, but when you hear a number like that, when you get that statistic, it makes you want to take action, not just for one person, but for an entire population. And the reason I mention that is because I was hoping that maybe you guys could talk a little bit about what you're seeing on drug overdoses and deaths among the adolescents since the pandemic. So we've talked about 2021, you gave an example. There's data out there on overdoses and deaths. What are you seeing? What do we need to address on that level?
We're still seeing increases in suicides. And you're right. I think that the new data shows that they are rapidly crossing all genders, races, socioeconomic lines. The LGBTQ plus community, we're seeing increased races there, or numbers there. When we talk about the long-term solutions, and Congress has certainly spent, I think, over at least 200 years working on these issues. When we think about the challenges of rural communities, for example, having access to care, the affordability of care, removing the stigma. If you're also dealing with socioeconomic issues, or you come from households dealing with socioeconomic issues, you're worried about having a home that's affordable. You don't have access to quality health care, whether it's mental or physical. You may be in a substandard educational setting. You may come from a single parent household, or one parent is incarcerated. You may also have drug addiction or substance abuse addiction in the household. All of those are pile-on issues, right? And so we have got to, as a nation, deal with the social ills that cause decay in certain communities in the first place. Look, the alarm is sounding. We have a mental health crisis. We're in a state of emergency with youth, particularly in rural areas. But our more longer-term work, and I think Congress leads the way, certainly with the help of states and local government, we've got to deal with poverty. We've got to deal with unemployment. We've got to deal with substandard education, substandard housing. If we do not fix the social ills that can certainly, I think, push people over the top, we're not going to be able to see the kind of progress that we need in this area.
Mayor, I want to pivot just a little bit and ask you, you spoke about the link, and you've been thinking a lot about this. And so you seem like somebody who likes to get things done, right? So you must be thinking about next steps after the link and how to address these social ills that the Congresswoman just talked about. What are you seeing as next steps for your...
Well, I think the challenge with this work is that it's not profitable. Okay? So the need is great, but it is a break-even and even loss leader for a lot of organizations. So, but for places like Helmsley and others that see the need and are charitably supporting it, the supply of providers is far dwarfed by the demand right now. Well, that's something we have to fix. Is we got to create some more parity between the supply and the demand. But what I will say is this, and I'm guessing we're towards the closing, so this might be my last word. In 2008, I started a social media marketing company. 2008, MySpace was the site. My first client, I made a MySpace page for a U.S. senator because he wanted to get digital. He wanted to reach these kids. What has happened in 15 years since I started that company is it's very challenging to be proud of some of the work that we did, knowing that social media has become, in my opinion, probably one of the biggest drivers of mental health issues in our youth. And the addictive nature of social media and the responsibility that the TikToks and the Metas and the Snapchats have, some of these challenges, there's a big issue there. And the topic of this is crisis response. We're responding, so these are the symptoms. What's the cause? And I think we got to start having real conversations about digital media consumption with youth. Because if there's one thing I could wave a magic wand and fix as a parent of 3 kids, 18, 15, and 11, it would be that. And if you want to see your child's childhood end, get them a smartphone, and their childhood will be done. There's no more playtime. There's no more. It's it. So that's a topic I'm passionate about. I sound like a get off my lawn type of old man when I'm talking about it, but it's a big issue we have to deal with.
Yeah, and I think we could start all over again
Yeah.
talking about social media, but it's also one of the specific areas that the task force is very much focused on. The internet is probably one of the greatest things that happened to us, but we would also say the internet is probably one of the worst things that happened to us. If we knew 40 years, 30 years ago what we now know, we may have done a better job in putting safeguards and controls around the use. But this is, again, an all-hands-on-deck issue. We're going to need a strong partnership between public and private sector. We're going to have to work with our schools. We're going to have to work with the American Academy of Pediatrics, Children's Hospital Association, and many others at the table. What I would wish the federal government would strongly consider would be an office that would help to regulate, if you will. I know that sometimes is a bad word, but really help to come up with national standards for the usage of the internet, for data usage, better safeguards, better protections. And it's really one of the main focuses of our task force, and I'm very excited. Experts on the task force, I'm very excited to see the work that will come out of that. We've had social media CEOs on Capitol Hill multiple times, right?
Mm-hmm.
As a police chief, I'm one of those people who question whether they have the ability to police themselves.
Right.
But I really would, I do have an answer for that, but maybe I shouldn't say it here. But I do question their ability to police themselves. But I think having a federal office that would help look at national standards, look at global best practices to really come up with policies, standards that would help better protect our children.
I think that's a positive note to end on. Actionable thoughts and things we can take action on. Thank you so much, you guys.
Thank you, Sarah.
Really appreciate it.
Thank you. It's a pleasure.
All right. I think we have another group of prestigious people to come up. Please come up on up. As they take their seats, I'm going to take a sip of coffee real quick because I'm addicted. When I was preparing to come on this trip, I was sitting in my home office, and I was, my teenage kids. I have a 14-year-old. Well, she'll be 14 tomorrow, and a 16-year-old. And my 14-year-old has a habit of getting off the school bus and coming directly down and checking on me. I was working on this, and I had the Bipartisan Policy Center's announcement for this event up on my screen. And I looked at her and I said, "Can you believe this number?" And it surprised me as a parent. It said, more than 40% of teenagers report persistent feelings of sadness and hopelessness. Alarming increases in suicide attempts, self-injury, drug overdose. I know we've been talking a lot about this today, sitting in my basement office with my teenage daughter contemplating this, I couldn't help but feel sad. And I'm looking forward to digging deeper on these issues with this group of people who have been kind of on the ground for years, working directly with this. Let me introduce them. We've got Walter Penzier. He's originally from California and was a paramedic there, moved to South Dakota, worked as a police officer in the Black Hills. I saw a video where you talked about how much you love being outdoors. So you were definitely in rural areas, and you are now the trustee of the Helmsley Charitable Trust, where you have spent a lot of time on rural and telehealth. We have Dr. David Ermer, who is clinical vice president here at Vera Behavioral Health, but you're also, maybe more importantly, a child and adolescent psychiatrist, so you work directly with the kids. And Karen Rosengreen, she is with us from Iowa. She opened the first state-accredited crisis stabilization there. Her official title is Vice President of Medical Services for Seasons Center for Behavioral Health. And last but not least, Matt Althoff. He is the Secretary of the Department of Social Services for South Dakota. You began that job in 2013, and you've spent a lot of time, I would imagine, working on the state Medicaid program, which includes behavioral and mental health services. So we have a great panel here to talk to us today. I was hoping Walter could start us off with sort of setting the stage here. Your passion for rural, right? Can you describe the youth mental health crisis that you're seeing in the rural areas here in South Dakota and where you're at?
Absolutely. First of all, crisis is truly the word for this. It is a very scary time to be a youth in anywhere, not just South Dakota, but any of the states. And we have seen so much with people just having higher suicide attempts, higher threats, cutting themselves, all sorts of things that are showing that we are truly in crisis. And it cuts every social and economic parts of society. It doesn't matter if you're a very wealthy person or straight very poor with struggles from families. It's everywhere. And in rural America, it's almost even worse, because you have to think in rural America, the clocks are a little slower. So really, when you talk about mental health, it's still very, very taboo. And this is small communities.
Yeah. Yeah, I'm going to skip over to Karen, because you were talking about small communities. This crisis stabilization center you opened was in a speck of a community, kind of northwest of Des Moines, right? So
Yes.
I think that when I think about crisis stabilization centers, these operations, I think of them in big cities. Why would a tiny speck of a city, Woodward, need a crisis stabilization center at that point? Why?
The reason we chose Woodward, Iowa was because we had the space for it, and it was right outside of Des Moines. This is back in 2015, and rural folks really have so much travel, and travel can become that barrier. So meeting them where they're at, right? That's what we need to be doing. And going to Woodward, we were able to get into those small communities and start to change that stigma, which is a whole nother arena that we could talk about all day too. I'm now in Northwest Iowa for Seasons Center. I'm opening another crisis stabilization center. I've been an integral part of many across the state of Iowa. And while I think they're a piece of the answer, it's kind of going back to just hitting those singles. It's not the full game, and we're just doing what we can in those small communities to make the difference.
Can you just talk a little bit more about who you're serving in those small communities? Who's showing up at those crisis stabilization centers?
Yes, absolutely. So the crisis stabilization centers that I've been a part of are for adults, but I think a piece of that too is that some of these adults are caregivers to our youth, and youth that are being affected in the mental health capacity. And we also provide mobile crisis, so a little bit of what you guys heard with that co-responder model, going out with law enforcement. I have a team that does do that, and we are starting to move to a model in Iowa where we're taking law enforcement away. When you show up at the door with an officer fully in uniform, what does that do to those on the other side? Typically heightens that mental health. They're afraid, they're wondering if they're going to be in trouble. Where are they going to end up? Is that going to be jail? Having a crisis stabilization unit is a safe space that they can go to heal.
Officers take them to that unit,
Yes.
and they can heal a little bit.
Yes.
Dr. Irmer, you are the person on the panel who probably works most directly with kids most often. And so I'm curious about what you're seeing, and especially what you've seen since the pandemic. How has that population maybe changed or grown?
Yeah, you talk in terms of pre-pandemic, post-pandemic. The problem was getting worse with suicide, depression even before the pandemic. And I think other people have mentioned it's only accelerated the problem. I think the social isolation piece, I think probably, to the mayor's point, more dependence on social media during the pandemic because you didn't have real life social interaction. So I think it's only worsened the problems.
Okay. And the kids that you're seeing, are they of all ages?
Yes, I mean, it's and again, part of the thing, these kids live with caregivers, and the caregiver stress during the pandemic was essential, was big too. So you're not just dealing with your kids, you're dealing with the caregivers who are experiencing the same stressful events during COVID. So it snowballed, and I think we're seeing just an increased need for services, and the statistics bear that out.
And I would imagine those kids are coming in not only from Sioux Falls, but from the surrounding rural areas too.
Oh, the problems are getting worse nationwide, but they're even more exaggerated in rural areas.
Okay.
The numbers bear that out.
So I want to take a moment to turn to Matt. You, at the state level, you guys created a 988 number line. And so the reason I'm asking about where the kids come from is because I took a peek at your dashboard. You created the line in 2022. On the dashboard yesterday, the top reason for calls was suicide and relationship family, those caregivers. And it looks like you tagged the numbers by county, and there are hundreds of calls from individual counties in rural areas. And so I was hoping you could just talk a little bit about if you are seeing that 988 number as a success, and what else you can do to sort of use that to help the youth out there.
One life taken too many is too many. So I would say we wouldn't put in the context of success, but we see it as a strategy. I think when we're talking in the context of crisis, it's really important that we in policy making and policy implementation, that we are strategic in the way that we're trying our best to create systems to interface with lives that are trending towards crisis. Crisis for that individual is a very traumatic event that can be life lasting with them. And so our goal in the department is to absolutely get to the mayor's great point about the causation, or at least at an earlier stage in which they're experiencing the anxiety, the depression, the senses of isolation. 988 is accessible to anybody at all times. And so what you have on the back end of that are master's level counselors that are very skilled and adept to meet somebody where they're at, to be that use those de-escalatory techniques, and to give hope to somebody who is barreling down a tunnel that only gets darker, and with the hope that we might ward them off from going any deeper into that. So we're very proud of the work that's happening with 988. It is but one. We also, too, are setting up the appropriate regional facilities of the crisis stabilization on a regional basis, along with a whole host of things that I would say also address the whole stigma that was mentioned earlier when we look at all the work that the department is doing to make certain that people are aware that mental health issues are real, and it's absolutely okay to talk about it. And so when you sense you're experiencing it, or somebody that you love is experiencing it, here are some of the resources. And that's one of the game changers that 988 takes away the reality, like I have to go to the yellow book and I have to look up who's a counselor to do it, because there's a huge referral element to 988 as well. So that's sort of in the strategy to the great metaphor of the day, the singles. I would emphasize that is another one too, is 988.
And in the federal report that just came out, the federal strategy game, in one of those little circles it says 988, so 988 is in a lot of states, right? And it says to recommend mobile units going out to those. Do you guys have those already in South Dakota? Is that a strategy that you're thinking about? Is
absolutely.
It useful?
Yep, absolutely. Another one of the singles that is happening, whether it's through telehealth or it's actually with crisis response teams. We've paired with law enforcement in multiple ways. That's a huge part about rural America, is you're dealing always with the infrastructure available to you. There's a finite number of people in a particular space. So some places it makes more sense to have the mobile unit on an iPad accompanying the law enforcement officer that's responding. And in some places, such as here in Sioux Falls, we actually have professional counselors able to accompany law enforcement, as was referenced earlier. So
how lucky am I to get to talk to law enforcement people today, so on these panels, because I think it is such a vital essence, vital key to this strategy. You were a police officer. You've worked on the ground both in emergency situations for years before becoming the trustee. I don't imagine you're still out there.
Not
okay,
anymore.
Okay. But that said, can you draw on those experiences and tell us, when you were responding, say, in the Black Hills, are the kind of things that Matt's talking about, these mobile units, these strategies, would they help? Did they help?
Actually, they didn't exist. And when I was a police officer in the Black Hills, we went out with very limited training. We went out I also worked in Mitchell, South Dakota, so I also worked in the plains of the state. And we were pretty much thrown out into the wolves. We were the last ditch first call, fix this problem, someone's threatening self-harm. And it's a very scary place. And we always erred on the side of being extremely conservative. So pretty much everybody got a 24-hour hold and got sent down to
jail.
the state. No, not to the jail, but to a state facility. So let's talk a little bit more on that. That caused a lot of expense to the county, to the city, and the wrong people were being held. And half the time I finished my paperwork, those people would be released because they weren't, qualified people in there. So going back to your question when it came to the iPad solution, as a trustee with the Helmsley Charitable Trust, we at the Helmsley Charitable Trust worked with the state and pioneered that. First in the country, really using Avera at the time with the virtual crisis care, where we provided iPads across the entire state, and it's not just the iPad's just the tool. So when a law enforcement officer now interacts with an individual, they get them in a safe place, they give them the iPad, and it's beamed to, it's now called Avel, but it was Avera. They're
An outsourcing group that has
outsourcing
therapists?
group of therapists, complete continuum. And so they talk with the patient. I don't call it a suspect. I've never called a behavioral health person a suspect. They're always a patient, okay? And that's key. They talk with the patient, and they determined whether they are a threat to themselves or anybody else, and they make the decision. That's key. You have trained people making a decision, not a police officer, but trained therapists. And what we found in South Dakota is huge. In South Dakota, we had a 75% reduction of transports to the mental health facilities, that they were able to get care at home, locally, okay? And out of the recall rate, okay, we had a term where they were called friendly faces, people who you see quite frequently. Okay, there was a 50% reduction of seeing the familiar faces. So that means it is working if you're seeing that much of a reduction. So it's not just a single. I kind of think that's maybe a double getting on the base on that one. But what's so cool is it was pioneered here in South Dakota, but it's spreading. Nevada approached us and said, we want this technology. We didn't go to Nevada. This was under Governor Steve Sisolak back during the pandemic, said they wanted this technology, and the trust made it available to Nevada as well. And they're seeing huge successes. And one thing I should back up on that technology is used for adults, children, everything, anybody having a threat. And in South Dakota alone, I just recently learned that 25% of the calls that they utilize that iPad technology at the Virtual Crisis Care Center was for youth. So a quarter of it is youth thinking of these suicides or attempting or threatening.
So I was going to bring this up later, but you're talking about these iPads, and that's the idea of telehealth, right?
Yes.
So I have just a couple of follow-up questions on that, and that is, are there places where they can't be used?
They can be used anywhere where there's a signal, but a lot of times, they can be used. What's really cool about it is they can be used at a home, or at where the event is. They stabilize it, so it's very valuable for the therapist or the caregivers on the other side to actually see the home conditions. But if there isn't a signal, they just bring them to the police station. They bring them somewhere where they can get a signal, either cellularly or a Wi-Fi signal. So it can be used anywhere, and that's where technology comes into play. As technology grows and gets better, these type of devices can get better. So unlike a double-edged sword, this is one area where technology and the internet and Wi-Fi has totally made this a game changer for treating and assessing mental health.
But this is telehealth, right?
It is telehealth, yes.
And so there is a comment that Dr. Ermer said to me previously that has stuck in my head, and I thought it was, frankly, I thought it was just so prescient, because we talk about telehealth. I hear a lot about telehealth in DC and helping rural areas, and what you said was, it's still the same number of doctors, right? So if you have somebody on the other end of this iPad, they still have a limited workforce to work with, a limited workforce to reach out to. And I was hoping, Avera expanded its behavioral health facility recently, and I just wanted you to maybe address this whole workforce challenge. There is a workforce challenge, right?
Yes. There's absolutely a workforce challenge. Just in child psychiatry alone, they think we need, they estimate we need at least 3 times as many child psychiatrists as exist. And it takes a long time to train, so that's not going to change overnight and may not change in the near future. So we're looking at strategies. How do you make psychiatrists more efficient? And one way is to go to the rural areas, work with the primary care doctors in the rural areas, and try to help reinforce, collaboratively reinforce care that they're receiving, so they don't have to travel to Sioux Falls from 200 miles away. You're meeting them where they are, and you're working with a primary care clinician who can sort of work together to help sort of mitigate the workforce challenges. And that's just psychiatrists. There's shortages of therapists, social workers, frankly, police officers, across the whole.
It sounds like you're talking sort of like an echo model where the psychiatrists or the specialists go out and train the people who are on the ground there to help fill some of the gaps out there.
It's a little bit like that, but we also manage, maybe we have a caseload of patients we manage, and we just help guide the primary care clinician where you don't actually see the patients yourself, but you help follow along with like measures of depression measures, for instance. Like, let's say we measure their depression scale, we coordinate with the primary care doctor and give them advice on how they can best manage where they are.
Matt's raising his hand.
I think it's essential. It was, I think, well articulated by the Congresswoman and the Mayor earlier. There is an undeniable increase for a lot of external factors in the incidence of mental health, behavioral health issues. It's essential, given what Dr. Irmer is talking about as workforces, that we do all that we can to preserve these world-class facilities like the one we're sitting in here, like the one that was referenced by Walter down in Yankton. Human Services Center happens to be in the Department of Social Services. There are ill people that absolutely need that, and they need the institutional level of care because they are a threat to themselves. So all of this pushing outward is really two things. You have to conserve the resources you have in the facilities, but also we're learning, as was well articulated by the Mayor, the socialization component. We return to homes, we return to communities. The closer we keep them, the more individuals that are there to be their support network become ingratiated with sort of the therapy that they've been accustomed to, the tools they've been given by their therapists, the resources they have at their sort of plug and pull, so that they can, succeed after approaching a crisis. Hopefully the strategic model here is obviously to ward off as many of those crises as we can, knowing we still are going to have the ill arriving to our facilities.
Yeah. The people, though, have to be at those facilities to take care of the people who are coming in. Karen, can you talk just a minute about finding the people to be at those facilities and how difficult that is?
It's extremely difficult. Our facility in Spencer, Iowa has been ready to go since October of 23, and we are not able to open our doors because we do not have the workforce. I think that a big piece of that, and I know we're getting to the end of our time, it is dollars, right? That's what makes the world go round, and it's the reimbursement rates. So until we have the federal, state, and local governments all on the same page and really seeing what the future is doing to our crisis and youth, I don't think there's going to be change. So it's reimbursement, and it's getting those dollars there for what we have. We're here right now, and I don't want to see where we're going to be in 5 years.
When I hear dollars in reimbursement, I also think state and federal payment programs. I happen to have a state secretary here who oversees Medicaid. So Matt, I do want to ask you about the Medicaid dollars. Some of it is reimbursement for these workers, these community health workers, these therapists. Can you address that through a state Medicaid program?
Partially, absolutely. But I would emphasize, too, let's bear in mind, since a big part of the federal partnership is through SAMHSA, and so there are a lot of federal block grants that are already in place to make sure that those are income qualified. We have the delivery in place for a lot of mental and behavioral health services are going on right now today, and I think that's true in every state. So I would say that Medicaid will be a part of it here in South Dakota, where we have a increased advantage if it is to be a tool or resource of this with the recent expansion that has gone on. Some of these services are in fact reimbursable, and they will help. It will not be, though. It'll have to be more creative than simply Medicaid, everybody's favorite plaything in government. I like to joke about that it was, to help Karen's situation to really be able to staff that, but actively looking at how we're going to have a sustainable reimbursement model absolutely in the department.
Medicaid has been a big issue here in the state. You had the unwinding happen, and then you had the state referendum to expand Medicaid. What are the Medicaid numbers looking like, and how can it actually, if you're enrolled in Medicaid, how can it help the patients? Maybe not pay for the workforce, but help the patients with these issues.
Well, two real quick. I mean, I would say that there are those that haven't previously had health insurance in place, and so if they're now becoming eligible, we're bodied and souled creatures. We're not just minds. So there's always a lot of things that the Medicaid can help them with that. Two, I would say our numbers. I think a comment would be that we are absolutely back to what we're seeing, what we were trending before the pandemic and the continuous health emergency that allowed for the ongoing eligibility that happened. So that's what we're seeing in South Dakota, is that trend, and so that that's a good indication that the economy is actually pretty healthy here in South Dakota, because it is a leading indicator. When you have a softening economies, your Medicaid numbers will go up. So we're pretty fortunate in that regard.
Yeah, no, that's interesting. So we've learned about reimbursement, staff shortages, some of the work with telehealth on the ground, the need, and I just wanted to sort of wrap it up with going back to my home office in DC. My 14-year-old walks in, I'm sad, and I wanted to ask you guys for sort of, what is something we can hold on to hope? What is it? When my daughter learned those numbers, you know what my 14-year-old said? She said, that makes sense, 40% people of my age feeling hopeless. But actually, I think the number is probably higher, more like 50%. That's really sad. That's really sad. So we've talked about all this today. What would you, each of you say, to wrap this up, is sort of the one thing that you would want to make sure happens in 5 years? Is it reimbursement? Is it more telehealth? What is it?
I can kick it off. There needs to be a lot of things happening, not just one. There is so much that needs to be done. And this is the first step, having a dialogue. And actually, it's refreshing to hear a youth actually speaking about mental health, because not too long ago, these youth were so afraid to share their feelings and share what's going on. And now that seems to be lowering the tabooness of mental health. When you hear youth talking about it, pretty soon you don't hear other people talking about it. And it's bringing a spotlight into the room where everybody can actually speak about it. Because everybody, I like to say, this analogy is probably not an appropriate analogy, but I'm going to say it anyways. Everybody goes back to when I was growing up. We always had that one crazy family member that nobody talked about. So
that's particularly funny.
It's really funny when you think about it. It was taboo within the family. And now we are able to speak and sit and actually command national attention on something where people didn't talk about this stuff. And now we are. And so it's just bringing it home, where now we have to come together as a solution. And it's going to come from multiple parts, from the payer, from technology, to workforce development, to getting more psychiatrists. Heck, we have such a psychiatrist shortage because psychiatrists are not paid that well. And it takes so much time to become one. It's very true. Look at the numbers. But so I know I'm droning on, but it's multifaceted is what I'm saying. There isn't just one takeaway.
Okay, that's valuable. What would you?
You're like,
yeah, they're not paid enough.
that part I echo, but it's a complicated problem. There's many pieces of the puzzle, as you illustrated. I think reform of the juvenile justice system, the vast majority of adolescents who break the law are not criminals. They're not destined to become criminals. We need to rehabilitate them. We need to, that should be, instead of looked at, hey, you're a criminal, we should say, hey, this is a warning sign that you may have mental health issues, and give them services. I think we need to look at social media. We need to look at reimbursement. We need to look at expanding the workforce and using the workforce more efficiently.
Absolutely.
And building systems of care. We have the technology. We have all the technology we need. We need to build good systems of care and have people working together, including working with the schools, where all these, all the youth go, the majority go to school. So that's a good place to start also.
Yeah, I think I'll add to that it's about connection, relationships, and collaboration. And really not reinventing the wheel. A lot of us are doing the same things, and how can we do it together and do it better? And I think starting what we did here today. It's just continuing this and not giving up. We're moving in the right direction.
Matt, are we moving in the right direction?
I'm not sure, quite sincerely. As the crazy man in the family, quite honestly, I'll just throw out something radically different and violate every principle of debate and bring up something new in the closing argument. I think the bigger context is we as Americans have had something very significant happen, and that is that all throughout our history as this experiment, we've had as an undergirding a faith life. And at the same time, in this rapid secularization, we have all kinds of faithlessness happening. And so I really think that ultimately is, if you keep diving at this and keep going at it, this is a critical thing that isn't getting enough attention, is the evil that's afoot, the secularistic sort of influences that are pulling people away from what historically have been a turning to God. And so that's I think, my concern is that that's the trend that I think really has to be sort of right set if in fact we're going to come together and we're going to realize how important community is, how important serving one another is, and therefore lift up one another, would be my take-home point.
Well, I think that, as Congresswoman Demings pointed out, when you know a human, it's pretty hard to hate them when you talk to another person. So a lot of speak about community today, some solutions. I really appreciate you guys being on this panel. It's been a great conversation, and I've got your numbers. All right. Thank you so much.